Hi, this is Madeline Anderson, and I will be doing the presentation about social justice analysis for me and Viridiana Angulo. So to start, we both agree with the question, which states, agree or disagree about the arguments made in the Beckemeyer and Butterfield article in terms of nursing and social justice. Has nursing lost our direction in terms of social justice, and should we return to the path of social justice? We both agree that social justice is to care for the patient as a whole, including its community. Bedside nursing is simply bedside nursing, caring for the patient and those surrounding their care. Healthcare has taken many turns throughout the years for the role of nurses. In agreement with Beckemeyer and Butterfield, nursing needs to take a turn for the better in social justice. Nurses exercising leadership in a broad system can make an impact on the patient as a community, regardless of social status. Healthcare should be for all, regardless of social status, and the role of bedside nursing is to care for all patients in a dignified manner. One of the ideas that supports this argument is the idea of compliance. Paul Farmer talks about compliance and access to care in his article. He mentions of compliance and access to care in which many of the people who are deemed non-compliant are those who are not able to be compliant, mainly due to poverty, also having minimal access to care. There's also the idea of healthcare for all. Rationing of healthcare is that healthcare can be rationed between the rich and the poor, making it available for all classes. Paul Farmer talks about this in the article in which it could be of help for those rich and poor. Rationing healthcare to the wealthy would leave affordable care and treatment to the poor, whom are unable to afford care. The concept of healthcare reform and cost effectiveness. Refusing to treat a patient because of poor cost effectiveness is unethical. Farmer talks in his article saying, quote, in a profit-driven, competitive marketplace, managed care is an oxymoron, unquote. Reforming healthcare only by cost effectiveness increases the inequality between the rich and poor, according to Farmer. How can we as healthcare professionals decide which lives are worth spending money on, which lives are worth saving, and which are not? Tong talks about the various power-focused feminist approaches to bioethics. She says that women tend to be more care-focused, while men tend to be more justice-focused. Most important task is to reform all healthcare systems that, quote, neglect vulnerable groups' interests, unquote. Care, not power, should be the center of all healthcare. Tong discusses how healthcare ethics have been historically male-dominated, having the most ethical values be justice, autonomy, and non-maleficence. However, healthcare practitioners must learn to share their power with the patients by being more empathetic and not simply practicing in a way they feel is best for the patient, but a way they feel that they and the patient feel is best for the patient. In conclusion, we agree that healthcare should be for all, including the community. People need access to care in order to be compliant, and rationing healthcare to the rich means the poor can have more access. Refusing treatment due to cost effectiveness is unethical, and care, not power, should be the center of healthcare. Thank you.